In this video, we provide examples how various feedback signals can assist during first standing exercises. The goal is to find balance on the prosthesis to help develop body awareness regarding prosthetic loading and posture. Esther instructs Milan to ensure his weight is evenly distributed between both legs. Adequate loading and weight shifting are the prerequisites for standing and walking with the prosthesis. The exercise focuses on learning to shift weight from one side to the other and on how to properly load the prosthesis. The feedback functions also include visual feedback, displaying the load on the prosthesis. When the prosthesis is unloaded, weight shifts to the contralateral leg, which is shown on the scale. Loading the prosthesis causes the small bar to move towards 100%. In addition to the visual feedback, an acoustic feedback signal for load on prosthesis is available in the app. When activated, a high continuous tone sounds if the load is under 40% of body weight, while a low continuous tone indicates when the load exceeds 70%. During the exercise, it is important that Milan does not move his pelvis separately, but that his shoulder and pelvis move together in unison. The feedback function load on prosthesis is available in all modes. To regain a sense of body balance after an amputation, it is also important to train shifting weight forwards and backwards. The acoustic feedback signal for load on prosthesis forefoot heel assists in improving this. This feedback signal is available in all modes. When first practicing weight shifting, ensure the patient is holding onto the bars. Milan can try how far he can shift his weight. A high tone indicates forefoot load, and a low tone indicates heel load. There is no acoustic signal if the foot is loaded centrally. Learning to load the forefoot is important, as it is needed later for moving over the foot during walking. Keep in mind that stability should be prioritized over mobility when training with a prosthesis. As training continues, reduce the use of the parallel bars and introduce more challenging exercises. Exercises that involve dynamic arm movements make it more difficult to maintain the load on the prosthesis. If the load drops below 40% of body weight, the previously activated feedback signal load on prosthesis sounds. Milan's goal is to keep the load consistent even when his trunk and arms are moving. In the beginning, this kind of exercises can be quite demanding. Adding weights to the dynamic arm movements makes it more challenging to maintain the load on the prosthesis. The trunk should remain as stable as possible, and the pelvis should not rotate, staying in its position. Milan must use his entire body to balance and counteract the dynamic movement. A good stance phase is a requirement for a good swing phase and for safe, efficient walking. It requires the prosthesis to be loaded properly. Esther instructs Milan to load his prosthesis with more than 70% of his body weight when stepping forward with his contralateral leg. For this exercise, colored markings or numbers on the ground are practical. Esther calls out a number for Milan to step on. With the feedback signal load on prosthesis activated, the aim is to maintain a continuous low tone until Milan shifts his weight back onto both legs. This tone indicates that Milan is putting enough load on the prosthesis to achieve a good stance phase. Lifting the hands off the parallel bars or using different walking aids with less support can increase the difficulty of this exercise. It is also possible to do this exercise with a stepper. The low tone serves as positive feedback, indicating that Milan is doing the exercise correctly.